Hello, everybody. I'm going to today discuss about baby and if they find it hard to breathe below 3 months old. Um, anyway, baby normally breathe faster rate than adult and older children, and sometimes they take pauses in their breathing, few seconds, and then rapidly breathe after that. By 6 weeks of age, they should have a more regular breathing pattern. Sometimes a baby breathing rate increases for a longer period of time if they are unwell, and also you can see they are working very hard. And for babies, that most tiring thing they do is feeding. So this can be the first time you notice the struggling to breathe. If they are too breathless to feed, they need to be seen urgently by a healthcare profession. It can be very scary that your baby have difficulty in breathing. So I'm going to tell you something when you will be very worried and when you have to do what. So, red signs means if your baby has the following like pale, mottled, feels abnormally cold to touch, has pauses in their breathing lasting for more than 10 seconds, makes a grunting noise every time they breathe out, or has blue lips, or they are stiff or rigid, or makes repeated jerky movement of arms and legs that does not stop when you hold them. That is called fit or seizure. And they are extremely agitated, crying inconsolably despite distraction, and confused or very lethargic and difficult to awake. And you may find a rash that doesn't disappear with pressure, that we call glass test. And less than 3 months if temperature 38 degree or above, if there is no vaccination recently within 48 hours. In that case, you have to go to emergency or call 999 in NHS area. Now, in amber sign, if that those signs I mentioned is not there, but there is difficulty in breathing, including first breathing and widening of the nostrils, pulling the muscles below the lip, ribs means ribs, your ribs cage is moving, not interested in feeding or looks dehydrated like dry mouth, shrunken eyes, no tears, very drowsy, no wet nappies for at least 8 hours, or sunken front lady. There is a soft area of baby's head. Um, and excessively sleepy, irritable, unable to settle with TV, toys, food, even picking up, and if very very drowsy, irritable despite their feeding, fever is coming down or getting worse, or you are worried, please you have to contact a doctor or nurse, ring the GP surgery or call NHS 111. If persists for more than 4 hours and you can see any of the sign, that red flag I mentioned you before, then you may have to go to emergency. Now, if none of those I already mentioned is there, um, it is normal for baby take slight pause in their breathing for few seconds or breathe rapidly for a short period. By 6 weeks of age, they should be have a more regular breathing pattern. So basically, you have to continue to take care of your baby at home. If you still concerned, you can talk your health visitor, local pharmacist, or in NHS area, you can call 111. So this is a nutshell to increase awareness about babies, that when they start breathing hard, or you are worried about babies breathing. Hope this increase your awareness. We will talk with something else next week. Bye for today.